Namaste, I'm Dr. Robert, and my subject today on 5-ish minutes for Dr. Robert is the 5 Vayus, which we could just as easily call the 5 Pranas, because in the context of the body, Vayu is manifesting as Prana. Vayu means that which moves. Vayu is generally externally identified by translating it as wind. So these are the 5 winds within the body. The difference, of course, is that there is in the body a difference between prana and vata. So prana is the vayu that circulates and provides the life force to the body, that invigorates the body, that makes the body feel well-nourished and stable and secure. Vata is the wind that is damaging wind, the gale force wind, the hurricane, the tornado that moves in the body in an abnormal way and destroys instead of creates. So what we want to do, of course, is always encourage Vayu to manifest as prana in the body and not to manifest as vata. So when Ayurveda talks about the 5 Vayus, they're talking about the 5 Vayus as manifestations of prana. And there is only one prana, there's only one Vayu. There are 5, or there are sometimes they are enumerated as 5 because of the different directions in which they naturally and normally move in the body. If we only talk about one Vayu, one prana in the body, we call it prana. But if we talk about 2, prana and apana, then we're explaining in that duo, by making it dual, we're explaining that prana is always moving in different directions, simply by saying that. And the 2 chief different directions it's moving in are downward and upward. And this is just practical bodily physics, because if all of your blood is heading downward in your arteries, your veins have to bring it back up. And if the blood is headed up into your head via the arteries, the veins have to bring it back down. So there's when we're focused on upward and downward movement only, we talk about prana and apana. When we throw digestion into the mix, we talk about samana. And samana is located in between prana and apana. Prana is chiefly in the lungs, apana is chiefly in the colon, and samana is in between the two in the main part of the digestive organs and their associates. And when we talk about 5 Vayus, 5 pranas, then we're talking about those 3 plus 2 others. The 2 others are Vyana, which goes from the heart out to the extremities of the body and then back to the heart. And we talk about Udana, Ud meaning up, and Udana chiefly is activating, working with the sense organs, causing upward movement into the head and promoting higher cognitive functions. When all of these Vayus, all of these pranas are circulating properly, then there is generally harmony and health in the organism and a feeling of well-being to go along with it. When the movement of these prana is out of sync, out of normality, then there is a disturbance. When things are moving properly, we say they are moving in an anuloma fashion. Loma or roma means the hair on the body. And when the direction of growth, the direction of how the hair is laid down and how it grows on the body, that is what determines the movement of prana on the surface of the body. So we always want to encourage prana to move in the direction that it wants to go, because when it moves in the pratiloma direction, when it moves against the grain, when it moves against the normal direction, that's when vata gets increased and disease is caused. This is Dr. Robert wishing everyone anulomana in the most positive of senses.